Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. I have with us today Dr. Bethany. And Dr. Bethany, I'm going to have you help me with your last name. It is so easy once you hear it, but to actually look at it and say it's difficult.
It's Pizkis.
Pizkis. Dr. Bethany, spell Pizkis for me.
P-I-Z-I-K-S.
So simple. So I'm grateful to have you here. It's such an interesting topic that we're going to talk about today. I think it is a really important topic. Why don't you start by giving us a little bit of your background? Tell us how you got into dentistry, and then what you've been doing to help dentists.
Yes, when I was a kid, let me tell you the reason I became a dentist. I was a kid. I loved my horses, and I came home from school one day, and they were gone. My dad had sold them because we couldn't afford to keep them. So in my mind, I'm 13. I'm like, well, dentists make a lot of money, and it's easy, and I'm never going to lose something I love for money again. So that's literally why I became a dentist, and thought it would be an easy way to make money, which is kind of funny to all of you who are dentists that we all know not true.
Right.
But so because of that moment, I remember that's when things started being harder for me. I felt a lot of anxiety. I definitely moved through the world differently. And I went into dentistry. I became a dentist. I started my own practice, built a beautiful building, and hit a wall of stress and unknown to me, all the business pressures, the leadership issues, the clinical issues. And I really became really depressed and stressed and full of anxiety. And it was affecting my body. It was affecting my relationships, my team, my bottom line. So I was really struggling.
So you're not alone, or you weren't alone in that. And, I myself, and as most people know, I'm not a dentist, but I do invest an hour every single day working on my emotional health, which to me equates to dealing with stress, mitigating stress. 46 years old, this is the first year I've ever really felt stress. Like I've actually felt the symptoms that stress causes. And I know, and I'm going to have you talk about this, of course, but I know how dangerous stress can be. Tell me about the dangers of stress. It is common in the dental industry. It is common amongst dentists. But tell me about some of the dangers.
One thing I know for sure is that as dentists, spending 8+ hours a day, very close to somebody who's full of anxiety for being there, affects our physiology. And it's dangerous in my mind because, well, it's true that our blood pressure goes up, our heart rate goes up when someone else is next to us who's very anxious or angry or whatever it is. So dentists in particular are very susceptible to that because of the time they're spending with those people. And 95 to 98%, this is a Harvard medical study, of diseases are as a result of stress. So stress is dangerous. More dentists today are dying from early stress-related cardiovascular disease than for any other reason. I know a lot of dentists in their 50s who have had heart attacks, who have had strokes. I have friends who've committed suicide. And it's a big problem in our industry. So I want to help. I mean, I walked that path, and I'm now helping. Instead of restoring teeth, I restore bodies, hearts, and spirits by reducing stress in a few different ways. So.
Let me ask you a question that just kind of popped into my mind. I mentioned that this is the first year that I've really felt stress. It doesn't mean that I haven't been stressed, right? So it doesn't mean that I haven't had a high level of stress. I just haven't felt it. So what are some signs? Maybe someone doesn't think that they have stress. Maybe they think everything is fine. Their relationships are going great. Finances are going great. Their team is awesome. Everything is just fantastic. Can that person still have stress? And if so, what may that look like? How does someone know and identify and diagnose themselves as having a high level of stress?
Yeah, of course. And I think some level of stress is a positive thing until it hits that tipping point. I personally carried so much stress that I was having heart palpitations. My neck and shoulders were constantly tense. I had headaches. I was exhausted, constantly exhausted, short fuse, easy to lose my temper, say things I would regret. My relationships were suffering. I think the body is so wise when it comes to stress. Your body knows. We forget all the wisdom below our neck that we have. We, as dentists especially, we have to be in our heads thinking about where we're going next and which room, and constantly thinking. But our bodies are wise. So listen to your body. If you notice things happening in your body, and as we get older, we start to notice it more. That's for sure.
Yeah, absolutely. So you talked about losing a horse over financial reasons while you're a child, and how that motivated you to become a dentist, and to make all this cash, so that I would assume you could buy a whole bunch of horses, was kind of part of the goal back at 13. And I know, I'd like to have you come back on the show to talk about this post-COVID, but I know that you do horse therapy, correct?
Yes, equine Gestalt Coaching I'm a certified equine Gestalt coach, which is a very specialty of horse therapy. And so I left dentistry because my passion was horses and helping others the way people helped me. I did get some help. I suffered a lot, and I finally reached out after doing some really unhealthy things like drinking a lot and getting divorced again and firing people and buying things. And I finally reached out. So my passion shifted from restoring teeth to restoring people's hearts and spirits. And I did become an equine Gestalt coach. But like you said, I would love to come back and talk more about how horses help dentists and their teams live less stressed lives. But I haven't been able to do that much this year.
Yeah, the COVID I can see would throw a wrench into that. So talk to me about what you're doing now. What are you helping with? How are you helping people with COVID or during? Let me back that up a little bit. How are you helping people during COVID? Obviously, there's more stress, less travel, right? It's harder to do one-on-one types of therapies and coaching. I understand that. And I also understand that you're involved with NuCalm. So why don't you talk to me a little bit about that and how you're helping people with NuCalm?
Yeah, about 6 years before I sold my practice, I was introduced to what's called NuCalm, and introduced to the company that makes NuCalm. It was a huge, important part of my own recovery, because NuCalm is a neuroscience technology that puts the brakes on stress in your body, and it allows your body time to rest and heal and recover, which is the only time you can recover is when you're relaxed. My body was redlined on anxiety, stress. I think so many people this year are suffering from that too, and unable to get out of that cycle. So what NuCalm does is it's a concrete tool that reduces stress response. It improves sleep quality, and it balances the human autonomic nervous system. So parasympathetic versus sympathetic. It puts us into rest and digest. And 20 minutes using NuCalm is like 2 hours of deep restorative sleep. So there's a lot of ways that you can use NuCalm personally and with patients. I have a story about a patient that I had her use it, if you'd like to hear it, or if you'd like to go a different way.
Yeah, I would love to hear it. I think we had a little audio blurb there, but you mentioned you had a patient that you worked with, that you helped with Newcomb. Yeah, please go ahead. Tell us about that.
Yeah, so Newcomb, it stops the anxiety response. So I had a patient who I'd known her for a long time, and every time she came in, she would cry the whole time, like just tears streaming down her face, and she could hardly open her mouth. And she was so anxious, white knuckle all the way. This patient needed a root canal and a crown, and I was dreading it as much as she was. And I said, I'm going to use NuCalm for this patient. And it was at the beginning when I first started using it. And I placed the NuCalm on her. It's headphones. It's a neuroacoustic software. It's a sticker on your wrist that has the frequencies of GABA imprinted into it, which is the opposite of having a shot of espresso. And it's light blocking your eyes with dark sunglasses. She was on this for 2.5 hours of her procedure, not one tear. She thought she was only there for 20 minutes because it dissociates your body from space and time. It turns off the stress response in your body. She left clear, relaxed, happy to pay her bill. And that was quite a change too, by the way. You know?
Sure.
So it helps with patients. And I think if patients are relaxed and less anxious, the dentist is less anxious,
Yeah.
and we do better work. And I'm not worried that, her jaw is going to close on my finger, or she's going to whatever, being so anxious.
So tell me, Dr. Bethany, how can a dentist learn more about this? How can I reach out to you and learn more about this?
Yeah. So if you want to know more about NuCalm, and I am in a partnership with this company to be transparent about this now, because I have paired it with my coaching and it had phenomenal results. So you can go to NuCalm.com or for more information, or you can go to my website, which is BraveheartGestaltCoaching.com, and my phone number is on there. So you can call me to find out. But, I don't want to leave this piece out. The most impactful thing about NuCalm it was for me as the dentist. And, every dentist has those days. I had a lot of them where it's lunchtime, you eat lunch and you're like, stick a fork in me. I am done. I can't even believe I have to do a quadrant of composites and then 2 more crowns and 7 more exams. And don't know how I'm going to get through that. 20 minutes at lunchtime on NuCalm. It's like a reset button to your brain, your body, your emotions, your energy level. It's like you have a whole new day. And, when you're on NuCalm, it's like you feel heavy, your body feels heavy, your mind still wanders. There's no drugs, no side effects. So I just want to make this resource, bring it into awareness, because I know people are struggling. And this is a concrete way to deal with so much stress. And over time, the benefits are cumulative. So I hope that helps. I know there's a lot of information about it. The neuroscience technology is very complex, but NuCalm is so simple to use.
Yeah, and it is obviously complex. And so I want to invite our audience to reach out to you directly to learn more about what you do. But most importantly, I think, the biggest takeaway I want our audience have today to have is reduce the stress. Figure it out, right?
Figure it out.
Contact an expert such as yourself. I think it's so important. We work so hard. We plan all these goals for the future. Retirement is always one of those, and what people have these beautiful images of what that looks like for them and what they're going to do. And then the day comes where they get a terrible health diagnosis that sometimes could be close to being irreversible. And stress can be a huge cause of that. So I know that's important to you, but it's also very important to me as well. I want to thank you very much for coming on the show today. We really appreciate it.
Thank you so much. I'm passionate about helping in any way I can, so I appreciate the time.
Thank you so much.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.